vaccine or no vaccine? The decision is yours. Join a panel of experts and a live Q&A for an open discussion about COVID-19 and the effects of the vaccine.
Just give us maybe 30 seconds, just an overview of, if you're saying, speaking to someone who's never heard of or anything, you just want to explain exactly what the vaccine is. Tell us.
A vaccine is something that prevents you from getting a disease or condition. So it's essentially what we do is we inject you with something which is similar or looks like or has a bit of, the coronavirus. Everyone knows coronavirus with spikes. And what the vaccines are, they're no different, but essentially they're trying to get a bit of the spike so that when the body sees it, it recognizes it and it remembers it. And you remember somebody, that's your friend or your enemy, you remember it. So next time it comes back, you'll know if it's your enemy what to do with it. But that's exactly what the body does. It remembers that's an enemy. So when it comes next time, it can just say, right, that's my enemy, I'm going to deal with it. And they do it different ways, but that's in essence all that vaccine is.
So we've got a few questions coming in from the live stream. Sorry, do you want to flip that one up again? This one says, I took my second vaccine in July. How long do you wait till you get a booster?
Interesting question. If you're a young person, this is a point that was touched on, that Bobby touched on, you've got COVID, it's a bit unfortunate you didn't get that. As it stands now, although COVID does make young people very ill, by and large, and luckily, most people are not ending up in ICU or are very unwell. So what they're doing now is monitoring what your immunity is basically your ability to fight COVID. Because you had COVID, you'll have ability to fight COVID. If COVID comes again, you're not going to get COVID again anytime soon. Now, if you had the vaccine, that will protect you. But like all protection, after a point in time, you forget it. So how long does that last? We know for older people, that's still 5-6 months, which is why they're giving older people boosters. For young people, as it stands now, the immunity is still quite high. So there's not any reason, unless you have an underlying condition, meaning you have something else, then it's different. So for most young people who are under 40, there's not any need to have a booster.
Yeah. Do we know in terms of, because that was one of the questions that somebody sent on the Instagram. They was asking, do you know to what level it protects you or makes you immune? Because I think, and I asked them to follow up to that, and they said, well, if it was like 1% or 2%, in their mind, would they see the kind of benefit, and if it was much higher?
No. These vaccines are very, 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 very effective. I mean, the protection from death and from getting seriously in a hospital, depending on whichever combination you get, depending on whichever study you're looking at, it's anything between 65 and 99%. And those studies are not real-world studies. The real-world data is even better. So there's quite clearly, we know these vaccines because before we were doing our trial data, and now one of the things I was attempting to show you, I'm going to show you a graph, because if you look at cases, the cases were high in the first year, and the deaths were high. And if you look now, since the vaccines, the cases are high, the deaths are not really high. So it's actually making a big difference.
Yeah, so would you say that this vaccine is there to stop you from death and they're taking it really far, or stop you from getting the COVID? Because I think another question that we had is, does it actually stop you from getting COVID?
So I'm just going to answer one of the questions, reflecting what David said earlier, is that some people get COVID and they don't get very sick. So why should they be vaccinated? If I had COVID and I'm not sick, why do I need a vaccine? But if you think about some of the statistics of some people who do get COVID and fall very, very sick and can end up in hospital on a ventilator and be very unwell. So, and that is not a nice experience at all. So COVID is something that hits us differently at different times. So you don't know that one time you might be absolutely fine with COVID, but the next time you get COVID, you might end up being very, very sick. The other thing with COVID is that we know that those people who had an underlying health condition, such as obesity, diabetes, blood pressure, heart disease, were really badly impacted by COVID. So whether you have an underlying condition or not, you've just got to think about how it's going to affect you. So the answer to your question is yes, it does reduce if you are affected by COVID, you will not be as unwell as if you did not have the vaccine. And secondly, we have seen that people who have been vaccinated are less likely to go into hospital for treatment with COVID. We've also seen a huge reduction in mortality, which is deaths dying of COVID. So it's very, very clear that these vaccines are working, and we are not losing our loved ones, because at the start of the pandemic, all I was hearing is somebody's lost their father, they've lost their mother, they've lost their grandparents, they've lost... tragically, people were losing family members so fast. I went to see a neighbour the other day, and I said, "Are you socialising now with your friends?" She said, "I hardly got any friends left. They all died during COVID." So you do hear these real stories, and I think that's what we've got to remember, is that it might not affect us today, it could affect us tomorrow.
And if I could just add to that, one of the other things that we're taking about is that when you put it together, we have families that we have our extended families, aunts, nans, etc. One thing we do know, when we do take the vaccine, you're less likely, if you get COVID, to spread it to other people. And I think that's something which is really important, because that's what happened in the first wave. People caught it and they spread it. So yes, it prevents you a lot of from getting COVID, and it also it reduces the chance of you spreading it. I think that's very important. And there's something else also to remember. Although we say young people don't get well, there's some young people who get very unwell. They've got people in their 20s who've been on ventilators, and some died actually young. It's not uncommon, but it does happen. And it's always very important to remember that. And there's something called long COVID, which you might have heard of. A long COVID, it just means that COVID doesn't get any better, and you just keep on getting symptoms. And young people get long COVID, so even though they're not getting ill, sometimes 5-6 months down the road, they're still getting shortness of breath. I know a friend of mine, he was a footballer, he's 38, he's very fit, and he has long COVID, and he's struggling now to run. He's a very fit fella. So, and again, as something we can't predict.
Did he get vaccinated, or he didn't get vaccinated?
He didn't get vaccinated. But I'm just making the point that long COVID is something to consider. So although we say COVID is mild for some people, for others it isn't. And even if it's mild, you can still get long COVID. So there are plenty of good reasons. Even though, yes, my friend got it and he was fine, you may not get, and you may get it again, and you may not be fine.
Another question that we've got through, they said, can you pass the virus on if you have been vaccinated? As some people say that you definitely can, and some people say that you definitely can't. So can you still pass on the COVID if you've been vaccinated?
John, do you want to say?
Yes, you can. Your chances of passing it on are reduced. Once, because when you have the vaccine, you're less likely to catch the disease in the first place. And depending on what variant you have, you're less likely, your viral load will be less. So you can pass it on, but you're much less likely to pass it.
Like, how likely in the percentage rise can have sort
From
of indication?
from what we've seen at the vaccine centre, is that people who are vaccinated are less likely to pass on the virus. That's definitely a trend. And if you have been vaccinated, then you're less likely to catch it as well. So then the chain, you're breaking the chain, and that's what these vaccines they're designed to do, is to break that chain. Because why we were all scared of COVID is because we were spreading it like wildfire. And if somebody is vaccinated, you are reducing the risk of spreading it. You're not completely stopping it. You can still spread COVID even if you have been vaccinated, but the likelihood of spreading it is much, much better. I would say probably down to 70%.
We've got some border questions are firing in. I've got a few other ones these are ones that are just flying in now. It says, if the government that led this country didn't follow the science, why should we?
That's an interesting question. It comes back to the question of.
I'm sure you guys have been asked this.
Yeah, that's what I was expecting this one.
You must have known this.
Yeah, I was expecting it. No, it comes back down to.
It's getting to the juicy part.
That's fine. Get the question. It comes back down to a question of trust, and that's why we're here speaking. As scientists, from your community, come here to talk to you, to say to you. People have different views of authority. People have different views of the government. What we're saying is, and I always get very personal because I lost an article. COVID comes and finds us. Don't worry about the government. COVID is coming to find us, and it found us here in Brent. It stayed here, it liked us, and the consequences were good. So I always say, with young people, just educate yourselves, get the right information, and you just need to make a decision. There's plenty of science on it, in the sense that we don't need to follow the science, but it's helpful to follow the science. you have to make a decision based on lots of things, how they interact with you and whatever. But you just have to say, in other words, if we all trust science to some extent. If I said, I don't believe science, and I go, just don't have a step over the edge. You wouldn't, because you do trust gravity. You do trust some science. So it's not to say, so we all trust science to some extent.
And it's funny because it's the same with any other medicine. So some people take antibiotics for every cold and cough they have, but some people just won't take antibiotics for anything. So it's really what your belief is in medicine. Some people like to treat things with herbal remedies and totally believe in, but there's very little science behind herbal naturopathic medicine. But if that is something that you truly believe in, there is nothing stopping you from treating your illness with herbal remedies. And I think that's the same with COVID as well. Some people believe that they can treat it naturally, but if you believe that there is some truth in these
Can be treated naturally.
If we could, then that would be great. But sadly,
or are there natural ingredients that kind of?
People would ask me this as a dietitian. People would always, at the start of the pandemic, would say to me, "What supplements should I take to protect myself, or what should I do to strengthen my immunity?" And I would say to them, "Well, if only you had started 10 years to build your immunity would be very, very tough at the moment. But I think we just don't know in which format this virus is going to attack us. Because it's attacked fit people, it's attacked athletes, it's attacked, my colleagues in hospital who are very active people, fit and healthy. Sadly, we've lost doctors, we've lost nurses, we've lost porters, we've lost, people working in, I don't know if you heard, recently we've lost a young doctor. So there is that fine line in looking at numbers, look at the trends. How many people have we saved in comparison to how many have we lost? So then you have to make your own decision.
What I was going to add as well, talks about trust. When the vaccine was first rolled out, what do you think the trust is like between the NHS and the ethnic minorities? Because a lot of, I'm not trying to start anything, but like a lot of different ethnic minority groups have a different experience when it comes to the NHS when you get to see compared to, let's say, non-ethnic minorities. So it's a case where when you get in, how you're seen by the doctor, how they treat you compared to how they treat someone else. Because you said that there's a lot of issues, a lot of reasons why vaccines being that's a lot come from the ethnic minority background, because it was a case where people didn't fully understand it. But coming from the NHS point of view, do you think the trust, what's the relationship like between them? Because I don't know if you saw this documentary. His name is David. He was a British actor. He did a documentary on BBC iPlayer about what it was like.
David Youre.
Yes. Thank you. Sorry. So yeah, you were in it. He went and talked about how black people are treated in the NHS and how a non-black person would be. So do you think what are your thoughts on it?
He's spot on, and there's plenty of history there's plenty of evidence to suggest that. We know that work-up poor outcomes. We know that black women are more likely to lose their babies and to get to problems. We know more likely that black men are more likely to get sectioned by psychiatry. We know lots of that. So I don't want to tell you otherwise. The NHS does. But what I would say is, to be fair, some of the colleagues, these are all experiences. People can always have many bad experiences. But I would say that the NHS is one of the best systems in the world, and the proportion of ethnic minority people in the NHS is greater than the whole population. In other words, more likely to see someone from your background in the NHS than you are in the whole population, particularly in London. That's the first thing. So, and I've worked in it before coming to the council. I worked in the NHS, and I know most of my colleagues who will try really hard, to look after and to do everything we can. So yes, we agree there are outcomes. Yes, they agree there are issues. But again, it's always just about educating yourself, asking questions, making complaints. You come, often say, we have a right open door. When people have problems sometimes in NHS, they come to us sometimes. And that's fine. We can look at things and we can advise people. So yes, there are issues. But what I would say that definitely for this pandemic, in a sense, although it affected us more, it affected everyone. So we're all in the same, we're all in it together. So you have to look at it from that point. You said that we're trying to get everything.
So you just had a question on this side.
I was thinking, do you think it's fair that society we are like pressurising young people to get the vaccine. If they decide they don't want to get it or they're not sure yet, is it fair to like make them feel bad or the bad person in society and they're like selfish and stuff like that? Do you think, because it's almost like it's like the reverse psychology, like if you force someone to do something, they automatically like, why don't I do it? But you're forcing it upon them. Like, do you think it's fair? That's essentially what's going on today.
I think that's a very valid point. You can't force somebody to do anything they don't want to, because this is their right. You have a choice, you have a voice, and the purpose of this discussion today is to know what the pros and the cons are. And as long as you yourself can make that decision of what is good for you, what is right for you, and what is working, what in terms of statistics and evidence. I often ask young people whether they've been vaccinated or not, and I have young children myself, and I had to question myself whether I want my children to be vaccinated or not. And it was a very difficult decision for both me and my husband, but I think what ultimately you have to decide is it's not just because my mum and dad don't want to be vaccinated. You should be able to, young people are very smart, they're able to Google everything, they're able to look up everything, but as long as it's not coming from TikTok or someone on has just put up and said, my face is blown up, and that's something that you can't necessarily trust, because as much as we like to share information on social media, there's very little backing from bodies or governing or organisations that monitor that feed. Whereas in the NHS, everything is monitored. We cannot even do anything without being scrutinised. It's really high, and that's why NHS is so valuable. It's a system where we cater for everybody. No race or gender or age should not matter. We are a system where we bring equality. If you compare our system to healthcare in America, we're very, very different. And we're no different to America in terms of what they've been hearing on social media, what our young people have. But at least we don't go around saying we're going to give you $100 to be vaccinated. That's just not the way to do things. We ask them to come forward, we give them the information, we give them the right to choose, and then you have to choose.
I think I was going to say another thing when it comes to young people is that when we see adults tell us to do something, we want adults to lead by example. So it's the case when you're told about how serious it is, how are you, for someone who has never experienced it, how are you supposed to take it seriously? You're going through something. I know you guys are not moved on to this situation, not to quite opinions, but when it came to the Matt Hancock situation, you guys know about that. He was preaching about this in time. And not going to go into it, we all know he did in the situation. So when I watched it, I was like, huh? I was being screamed at as a kid. During that time to stand or don't do anything. But when you hear things now, that these are the kind of things that's going on, it makes you wonder how serious was this thing? If you've got government officials taking and doing what they're doing.
I think what you've got to remember
that we've been a part of.
I totally hear what you're saying. That was a bit of a drama that caused during COVID. But what you've got to remember that the government institute and the NHS are two different organisations. The NHS are there to protect and help and serve people's health. The government are there to create policies and to run a country. So we try not to mix the two together, otherwise we're never going to be able to run an efficient healthcare system. And sadly, they kind of put a damper on the hard work that we were trying to do.
Yeah, I think situations like those, obviously, just as a public see stuff like that.
Exactly, and NHS sadly is not sexy. People don't want to hear about it. But what happens in the government is better headlines, and it's more juicy. So, and that's what people want to hear. So, but behind the scenes, people are working tremendously. My colleagues are working day and night, saving lives, helping people to get through this pandemic. And I will just say that hats off to them. People who've been away from their families, their children, and who have sadly lost their lives working on the front line. So we can't deny that. There have been a number of people who have tried to do whatever they can to save others. But at the same time, we have some duty of care and respect to them. But we are a democratic country. We have a freedom. We have our freedom. We have a voice, and we have the choice to make those decisions ourselves. We should not be forced by the NHS or the government to make those choices.
Yeah, I think I agree with that. The question that came through because vaccines often contain, or predominantly the ones that the conventional vaccines contain a fragment of the virus in it. Does this vaccine contain the virus, the COVID-19 virus in the vaccine?
I think what they're referring to is what inactivated, usually like the live viruses or inactivated viruses. Traditionally, when we made a vaccine, we took a virus and then we kind of damage it so that it's not as infectious, and then we would inject you with it. We still make some of the old vaccines are still like that, but these vaccines now we have all genetically made, so they're not made from the fragments of the virus. We just use the genetic coding, which is the thing that tells you how to make the virus, and that's all. And that's why they're such good. That's why they're such good vaccines, and that's why they're able to make it.
So that process is a normal process these days.
Yeah, that's a normal process. Yeah, whereas before we used lots of live viruses. They're literally what live viruses.
Somebody's got a direct question for yourself. They said, why was it difficult for you to decide if your children should be vaccinated or not?
Again, I think it's the evidence.
And just the party with that, she was interested to know what your concerns were.
Sure. I think as a parent, obviously I'm a medic as well, but as a parent, I want to know whether there were any long-term risks to my child. But I think the decision we made was that if it's saving lives in adults, we don't know how this virus is going to impact on young people's lives. And one more thing is that I have elderly parents who live with me, and what we were seeing is that young people were bringing COVID home. As we opened up the doors, people were going out, children were socialising. Children who were not vaccinated were carrying the viruses, of which we couldn't bring it back home, and we did not want that to have an impact on their elderly grandparents. So that was our choice, that to protect our elders and to protect myself and my husband, because being from an ethnic minority community, not knowing how this virus could affect us, we decided that it would be best if our child would be vaccinated to protect both himself and his family and his grandparents as well.
I had some questions on, but due to lack of time, I'm not going to go into it. But for me, I asked, as a young person, if you were planning on going into NHS to work, we've now seen COVID at its best. We've seen the effect it has, we've seen how it affects doctors, nurses, everyone. What would your message be for someone who's considering their journey going into the NHS work as a doctor and nurse, after being in the whole 2 years of trauma, you said it took away right now. Trauma has that situation. What would you say to push them into that? Give them an analogy.
Yeah. I think I would just talk from my experiences. I am very honored to be working in the NHS, and I think the NHS has given me a huge platform. I'm female, Muslim, young woman in the profession, working around lots of male-dominated, privileged people, and the NHS has given me a lot of respect, and I love the NHS, and I cannot fault it. And there are faults, but I think it's really given me the respect that I should have deserved in any other field. And I would encourage the young people to come forward and really, if they want to care for others, it is a great institute to have.
Yeah, I would add to that. I was lucky enough, I'm not going to the NHS, all my uncles and aunts go to the NHS, like, yeah, my mum is a small town hospital, and I looked at it and said, this is where I want to be. And, it's a really rewarding place. I often tell people, it's so nice when you can do something and you can make a difference. You can see someone not in a good place and then come back sometime later and you can see them. I saw, a couple years ago, I saw a young man, and he came to me with a doctor, back home visiting my parents. And he said, you don't know what I said? He said, no, you delivered me 2 years ago. And his mom was really ill. Remember that, he was just a big, tall, strapping man. So it's show my age. But it's that rewarding nature you have from helping people and doing whatever. And it's helpful to help our community. You talked about your experiences in the community.
We need more people from our communities to come into the NHS, to build that trust, to reduce those health inequalities, to reduce institutional racism or inequalities. One thing I will say, that when I was at university, I was told, if you're going to go in the NHS, forget about making a million. So you're definitely not going to make any millions if you're in the NHS, but it's definitely a common profession.
And you mentioned science, which why should we trust in science? Well, if you have to make the science, then you'll have a bit, because we study science and we have to make some science and we did a lot of work that went on. You have to understand it and you can feel part of it, so you can trust it and make it. So that's our challenge, and you to look at it that way. If you don't trust the institution, well, you can make it better.
Yeah, I would second that as well. If you want change, then you make change. You have to be part of the change. You have to be part of the change.